I'm going to tell you just briefly that there are some different kinds of depressive disorders. At the top, we see dysthymic disorder, and I describe that as sort of a low-grade chronic depression. Someone is able to feel happy about certain events occurring in life, but when that event ends, they feel a little bit less well than most people do on average. And those people I describe as sort of running on 6 out of 8 cylinders. They do all right, but it never is great, and it never is what they're fully capable of. And we want to treat dysthymic disorder just like we do the other depressive disorders. What we think of as depression often looks like major depressive disorder. Here's a time when someone returns to baseline mood, and then when they dip and drop down. And it's very difficult to experience depression because often you don't know when it might begin to lighten up, and it might begin to move back in the direction of improved mood. So when someone's very depressed and feeling low, the difficulty often could be, if I feel this way forever, life isn't feeling. It's very difficult. Bipolar I disorder is the classic, probably what you think about when you hear the term bipolar, would be extremes of mood. So when someone has manic episodes, they feel expansive, very confident. They might make poor decisions about spending, sex. They might think that they're writing the next popular American novel and be convinced of it. They might gamble or spend foolishly and then regret it later. And then when that person begins to experience depressed mood, they go down into a depressed episode. And that's very difficult because often people will present to us and tell us about the depression keys, but they don't always identify the manic part as problematic once it's really extreme and other people notice it. In bipolar II disorder, we have a similar pattern, but with bipolar II we're seeing what we call hypomania, which is sort of mini-mania. It's not as extreme. The person's energetic, playful, sometimes charm you, and it doesn't affect or bother other people as much as someone who's truly manic, who might have really disturbed thinking, might be really expansive, and think that in bipolar I, if I put my head closer to your head, I'll be able to pick up on your thoughts, and really believe that. So again, from severe mania at the top, high energy, down to severe depression, you can think of that as part of one continuous polar. So again, in bipolar disorder, we have the switching back and forth between expansive, manic, or hypomanic mood and depression. So there aren't many people in the population with these disorders, but when they're there, they can interfere greatly. And we have to really think about correct diagnosis, because if we understand that someone has depressed episodes and give them antidepressant medication, we might push them into mania or hypomania. Because with bipolar disorder, we want to treat with mood stabilizers, not just antidepressants. So what happens? If people are bipolar and they don't recognize it, other people don't know how to help, there can be damaged relationships, poor job or school performance, or inconsistent school performance, and there is a high rate of suicide, which is very alarming to us. But we can treat it effectively if we recognize the disorder. And I know one piece of research said it can take up to 7 years for the healthcare system to correctly identify bipolar disorder. And so for 7 years for someone to have these ups and downs and be treated with antidepressants only, which drive mood states and make depression and mania worse in people with bipolar disorder, it's very important that we correctly identify and treat these disorders. So again, with mania, hypomania, I described it a little bit, but you'll see people who have a lot of energy, don't really feel the need for sleep, they're restless. So sometimes people report mania being a real enjoyable experience, feeling great, energized, losing weight, feeling like they can take on the world. And other times people report that it's very uncomfortable. I have racing thoughts, I can't slow down, I can't express everything that's happening in my head, distractibility, inability to concentrate. And when it's really uncomfortable, people tend to move forward with that and be much more forward about it. When it's an enjoyable feeling, people often are concerned about taking medication that might lower that experience, lower their mood, because they fear that it's the only time in life that they feel good. So again, it's important to treat appropriately so that we prevent people from getting psychotic or having thought disturbances, and that we don't reduce and depress mood to the point that the person experiences sadness, depression, etc. We're really concerned about alcohol abuse and drug abuse because people will often try to find their own recreational medications to manage bipolar disorder, and that is often ineffective because with those drugs, we have habituation and tolerance develops, and what might work in the beginning might require that you drink more and more and more if you're trying to use alcohol to manage bipolar disorder. People that might be provocative, intrusive, or very aggressive to be suffering from bipolar disorder, it's very difficult, but often we need to meet with students and talk about all the different things that are happening in their lives and whether or not some of that's due to a substance or medication, or whether that's really a mood disorder or bipolar disorder. And the amazing thing about bipolar disorder is that at times I've worked with students who really can identify that there's something wrong or something unusual about their experience. And then within 4 weeks, that same person can say to me, I figured this out. It's about the depression. The mania is not a problem for me, it's the depression. And they'll talk themselves out of having bipolar disorder. So I've kind of come to expect that anyone with bipolar disorder will really have a hard time with that possibility. When I bring up that diagnosis, when people say, oh no, it can't be that, I get a little bit more suspicious. Okay, any questions about bipolar disorder or major depressive disorder?
What's a mixed episode, or like what are some symptoms that are common?
With mixed episodes, you might see someone that has a more complicated presentation. They could go from laughing to crying within like 5 seconds. It's like they have the extremes of both moods at the same time, and they feel very confused. I'm crying, and then I'm also elated, and then I can move into mood extremes very quickly. And people with those mixed mood states report that it's very uncomfortable. And we need to be very careful just giving those people antidepressants and mood stabilizers that aren't going to push them to mood extremes. Okay, is that still?
Yeah. So it's like with time between like switches?
For people who really have mixed mood states, it's like the two mood states occur at the same time. So that chart of high and low, if you superimpose them on each other, they're having the extreme both at the same time. Very, very upsetting, as you can imagine. Someone can cry in one moment and then be furious and angry or forceful at another, or laugh. And a few seconds later, they feel both those extremes at the same time. Visually. Okay. Yes, one other question?
So on like depression, it's more of a long-term
well, it really depends. There's often a family history for bipolar disorder, and when we have a family history on one side or another, or both sides of our family history, it may be that bipolar disorder runs in the family. When that happens, it doesn't mean the next generation is going to see a higher rate of bipolar disorder, although it could. It means that there's going to be a higher rate of depressive disorders. So you might see unipolar depression without the mania. But yeah, it's often, especially bipolar 1, where you have the extremes, it's often a disorder that's going to require medication and treatment for quite a bit of time, almost the entire lifetime. And people can learn ways to recognize what I would call prodromes, or what's going to be predictive of a mood extreme, and they begin to recognize what those are, and they know that it's coming, and they need to do something. But yeah, it may require medication for a lifetime, treatment to manage some of those extremes.